First and foremost, I'm going to introduce each of my group members. First of all, I'm Audrey Josephine. I'm going to present about the pathophysiology and the symptoms of dysuria. Secondly, my friend here, April Erin, she is going to tell us about the treatment conducted for dysuria. Thirdly, my friend here, Marita Marie Bernard, she is going to tell us about the diagnosis conducted for dysuria. And lastly, Miza Shamina, she's going to tell us about the introduction part.
So, what is dysuria? Dysuria is a pain or discomfort while you urinate or pee. It is a symptom that affects women more than men and can appear at any age. Typically, you will feel a pain or a burning sensation. Dysuria is caused by irritation of the urethra or bladder trigone. Trigone irritation causes the bladder to contract, which result in frequent and painful urination. Dysuria usually arises from a lower urinary tract infection, but an upper urinary tract infection is also a potential cause.
Right now, I'm going to present about the pathophysiology of dysuria. First of all, colonization. The bacteria colonize the urethra, which is the tissue of the urethra, and allows ascending through via the urethra. Secondly is uroepithelium penetration. As the fimbriae ascend, this allows the bacteria to attach and penetrate through bladder epithelial cells. Third is ascension. Ascension occurs when there is enough and also sufficient bacteria that colonize and causes the bacteria to ascend through the ureters. Fourth is pyelonephritis. This bacteria ascend, infect the renal parenchyma, and this is result with pyelonephritis. Lastly is acute kidney injury. If the inflammatory response keeps on continuing, this results in interstitial edema, interstitial nephritis, and also acute kidney injury. Right now, I'm going to explain about symptoms of dysuria includes upper urinary tract infection and lower urinary tract infection. A urinary tract infection is microbial infections. These organisms are too small to be observed without the use of a microscope. Bacteria are the most common cause of urinary tract infections, followed by fungi and in rare occasions viruses. UTI are the most prevalent human infection. Most UTI only involve the urethra and bladder in the lower tract. However, it also involves ureters and kidneys in the upper tract. Upper urinary tract infection can be potentially fatal if bacteria from the sick kidney enter the bloodstream. This disorder is also known as urepsis, can result in life-threatening low blood pressure, shock, and death. UTI in the lower tract damage the urethra and also the bladder. One of the symptoms of dysuria, upper urinary tract infection includes high fever, cloudy urine, the intense to urinate, vomiting, and also nausea. Urinary tract infection in the lower tract damage the urethra and bladder. The symptoms of urinary tract infection of the lower tract includes the bloody urine, pain in the abdomen, and the intense urge to urinate. Lastly is the symptoms of dysuria is urethritis and vaginitis. In urethritis, it causes discharge from urea and redness around the opening of the urethra, while for vaginitis it will cause pain and soreness or itching in the vagina.
I am Bernita Mary May,
and I will explain the diagnosis for dysuria. To diagnose dysuria, there are a few tests that can be conducted. Firstly is pelvic examination. This test is usually for the woman. Women should have this test to detect a perineal inflammation or lesion and vaginal or cervical discharge. While for the men, they can undergo external inspection to detect the penile lesion and discharge. Next is bladder scan. Bladder scan can give information about the bladder wall, the reticulum of the bladder stones, and large tumor in the bladder. While for cystoscopy, which is a procedure that allows the doctor to examine the lining of the bladder and the tube that carries urine out of the body, which is through the urethra. A thin camera called cystoscope will be inserted into the urethra and passed into the bladder to allow a doctor or nurse to see inside. And lastly is urinalysis. Urinalysis is the most commonly used to help to quickly confirm a diagnosis of urinary tract infection or aid in diagnosis of possible urinary stones.
This is Aprilline Erin, and I will be explaining about the treatment. So, the most common and cost-effective medications prescribed to patients is antibiotics. So, antibiotics is usually used for patients who have bacterial infections such as STDs, UTIs, and bladder infections. Next is phenazopyridine. It is to relieve irritations and stinging of dysuria. For best results, it must be taken 3 times a day. Patients are usually warned about the intense orange color of urine. It also comes with other side effects such as dizziness, headaches, and nausea. Next is dietary modification. It is advisable for patients to reduce foods and drinks that can irritate the bladder. This includes alcoholic beverages, highly acidic foods, and spicy foods. Lastly, it is advisable for the patient to drink more water. This is to reduce urinary concentrations, which leads to less burning. So there are many ways for us to prevent ourselves from getting infected by dysuria. These preventions highlight mostly on our own hygiene. So one of the ways is to practice safe sex. For example, use condom and other barrier methods, as infections are most likely to be sexually transmitted. Next, for female, it is advisable for them to use some additional tissue to wipe urine from inside the vaginal lips after urination. Lastly, for those who wear urinary incontinence pad, it is advisable for them to change the pad as soon as it gets soiled. That is all from me. Thank you.